Hi guys, my name is Sam. Today I'll be talking about environmentally cold injuries for my concepts in athletic training class. So for my intro, there's a wide range of sports that could be affected by cold, wet, and windy elements in the winter months, such as cross country skiing, snowboarding, things like that. If safety precautions aren't taken seriously, then there's a risk for different types of cold injuries. So having an understanding and educating individuals on the physiology, prevention, recognition, and care of cold injuries is essential for all healthcare providers. All right, so the different types of environmentally cold injuries. The first one, hypothermia, which is a decrease in body core temperature that's below the normal range of 98.6 degrees Fahrenheit. Hypothermia is categorized as mild, moderate, or severe. Frostbite is the freezing of body tissues. And like hypothermia, it's also categorized as either mild or deep. Frostnip is also part of frostbite. It occurs before, and it's very mild. Chilblain or pernio is an injury occurring from being exposed to long in cold or wet conditions, usually about 1 to 5 hours. And immersion, or as everyone else knows it, trench foot, is a condition that affects the nerves and blood vessels of the soft tissues after being exposed for a very long time, usually up to 12 hours and up to 4 days. All right, so for hypothermia, chances of getting it are very much higher when there's wind, wetness, or chillness involved. Heat loss occurs through body radiation, evaporation, and respiration. So when you're out in the cold working out, your body's giving off heat, therefore you're sweating and is evaporating, and you're breathing really heavy, which is causing you to lose heat. So some mild hypothermia symptoms. An individual's core would be between 98.6 degrees Fahrenheit to 95 degrees Fahrenheit. They'd be very tired. Their body would start shivering as a means to try to keep it warm. Their extremities would be cold, and they'd have a loss of fine motor skills. So fine motor skills such as texting on your phone and using your fingers. Moderate hypothermia symptoms. An individual's core would be between 94 to 90 degrees Fahrenheit. They'd have a very low breathing rate, so respiration, and a very low pulse. They could possibly have cardiac arrhythmias, impaired mental function, slurred speech, loss of gross motor skills. So gross motor skills such as throwing a ball or using your feet to play soccer. They'd have dilated pupils, low blood pressure, or blue discoloration to the skin. Severe hypothermia symptoms. The individual's core would be below 90 degrees Fahrenheit, which is not good. They'd have bradycardia, which is a very low heart rate. Again, very low breaths, so respiration. Hypotension, so low blood pressure, could possibly go into cardiac arrest or even a coma. So treatment for hypothermia. If someone is suspected to have it, transport them carefully if they're not already in a warm building that's protecting them from the elements. Call EMS and look for signs that determine if CPR should be used. Remove wet or cold clothing. Cover the patient with dry, warm blankets or clothes, including the patient's head. When you're rewarming a patient, only apply heat to the trunk, groin, and chest wall, as those parts take up the most heat. And while rewarming a patient, monitor vitals until transported to the hospital. All right, so for frostbite, is one of the body's mechanisms to try to keep the core temperature warm. So vasoconstriction occurs of the arterioles to keep warm blood more in the center of the body rather than the extremities, such as the nose and ears, which is typically where you would see frostbite the most, which is the nose and ears. There could be damage to deep tissues, and cells begin to freeze around 28 degrees Fahrenheit. As I said before, frostnip occurs before frostbite, and it's only the superficial tissues that are being affected. However, with a repeated exposure to the cold, it can then develop into frostbite. So some mild frostbite symptoms include dry, waxy skin, edema, a burning or tingling sensation, white, blue, or red discoloration to the skin, very limited movement, cold and firm affected areas. And for deep frostbite, symptoms would be hard and cold affected areas, waxy and immobile skin. So immobile meaning usually you can pinch up your skin and it goes back to its normal state. But with deep frostbite, that wouldn't be the case. There could also be white, gray, black, purple discolorations to the skin, a burning, aching, throbbing pain in affected areas, tissue necrosis, a temporary loss of motor and sensory functions, and blistering can occur within 36 to 72 hours. Treatment for frostbite. So superficial frostbite, look for signs of it. Then rewarm the patient using room temperature building or having another individual use their body heat to rewarm them. Do it slowly and avoid hot water temperatures of 98 degrees Fahrenheit or more. Do not use friction to apply heat, and once rewarming, do not allow the affected area to refreeze, as this could cause tissue necrosis. Deep frostbite, rewarm affected area using a warm bath, usually 98 to 104 degrees for about 15 to 30 minutes. Remove any tight clothing on the affected area. Monitor the water temperature and also circulate the water. And do not use steam, dry heat, or friction for frostbite injuries. All right, so for chilblain or pernia, it's an inflammatory response to extended exposures to cold and wet conditions. The severity of it is associated with time and temperature. Hypoxemia and vessel wall inflammation can occur with a constant constriction of blood vessels, most commonly in the hands and feet. Symptoms include lesions, swelling, tenderness, a burning, tingling, numbness sensation, itching, skin necrosis, or skin slowing. Treatment for chilblain or pernia. Remove any damp or tight clothing. Dry, elevate, and then cover the affected area with warm, dry blankets or clothing. Using high heat, apply lotions to affected area and start to use a friction massage motion. Do not disturb any blisters that might have formed. All right, so for trench foot, it mostly affects soft tissues, nerves, and blood vessels due to an inflammatory response that causes extracellular fluids. Mostly affects the feet that have been covered in wet footwear with temperatures ranging from 32 to 65 degrees Fahrenheit. Symptoms include loss of sensation, again, tingling, burning, numbness sensation, swelling, pain, sensitivity, blisters, and fissures. Treatment for trench foot includes clean and dry affected feet. Use heat packs or submerge the feet in warm water, ranging from 102 or 110 degrees Fahrenheit for 5 minutes. Replace wet socks with a dry, clean pair and allow wet shoes to dry before putting them back on. All right, so the prevention of environmental cold injuries. Again, you always want to educate your patients and athletes on consistent hydration, proper clothing and layering, and properly warming up before activity. So layers such as Under Armour and then a long sleeve t-shirt, a sweatshirt, a very heavy winter coat, and then have them warm up for maybe a little more than they usually would, just to get their bodies warmed up and not cause any injuries. Be aware of conditions and weather before sporting events and practices, and then again, dress accordingly. Also, take into consideration of windy and wet conditions using the wind chill guidelines, and monitor athletes' practices and games to ensure they're not out in the conditions for too long. And identify and record patients who have had previous cold injuries to ensure proper recognition and treatment, as those patients can be more susceptible to getting those injuries again. So for our wind chill chart, depending on the temperature and wind speed in extreme measures, frostbite can occur quicker in different situations. So your temperature there would be up at the top, and how fast the wind is would be on your left side. And again, so say if the temperature was 5 degrees out and you have a wind speed of about 30, the wind chill factor would be negative 19. So frostbite can occur within 30 minutes of being outside. So again, using this chart can help you monitor these practices and games and make sure they're not out for too long. And that's it. All right. Thank you guys for watching.